Hi, I'm Alexis Cate. I'm a licensed clinical social worker and trauma specialist, and today I'm here to talk to you about high-functioning depression. Please make sure to look at the description below for all of the resources that we discuss in today's video, which are linked. In this video, we'll discuss the definition of high-functioning depression, possible signs of high-functioning depression, the risk of high-functioning depression, and 7 tips for managing high-functioning depression. High-functioning depression is a term that is often used to describe a person who experiences depressive symptoms, however, is able and capable of functioning well in work, at home, or school. They may have milder symptoms of a depressive disorder or be able to hide their depression altogether. A high-functioning depressed person may always have a smile on, sometimes referred to as smiling depression. However, that does not change their mental health and whether or not they have a condition. Underneath and internally, they may be experiencing hopelessness, irritability, poor appetite, poor sleep, difficulties with concentration, amongst other symptoms. To learn more about smiling depression, we linked an article that we published below for further reading. High-functioning depression symptoms and signs include tearfulness or frequent crying, low productivity or a decreased level of activity overall, less involvement in generally enjoyed activities, appearing to have low energy despite receiving adequate sleep, irritability or anger, poor or increased appetite, difficulties falling or staying asleep, excessive sleep, and for teens, potentially even more than 10 hours in a day, comments around feeling hopeless or that life is too much or overwhelming, being very self-critical, statements of feeling sad, down, and even empty, difficulties with concentration, and frequent comments about regrets in the past. High-functioning depression may feel like being sad or having low energy, yet still doing what needs to get done. Thoughts such as, I can do this, I just have to push myself through the day. Thoughts also such as, people count on me, so I have to do what I have to do. High-functioning depression is not its own distinct clinical diagnosis. Therefore, these signs and symptoms may be speaking to a diagnosable form, such as major depressive disorder or premenstrual dysphoric disorder, and even persistent depressive disorder or dysthymia. To learn more about the different types of depression, such as major depressive disorder and persistent depressive disorder, we've linked a video that we've published below. People with high-functioning depression or functional depression may feel as if they are caught in the middle, so to speak. They may be too well to actively display their symptoms. However, they may also be too unwell to truly engage in relationships and their responsibilities. High-functioning depression may feel as if it is more desirable than severe depression. However, high-functioning depressed people experience their own set of unique challenges. The risks of functional depression include: some people may minimize their struggles. People with high-functioning depression may not want to recognize their needs or acknowledge their struggles in general. Some people feel that they should not be depressed. They may feel that their issues are all in their head or that they just need to snap out of it. Unfortunately, this way of thinking breeds guilt and shame, which only maintains and worsens depression, ultimately keeping one stuck in their situation and the cycle that they've experienced. Additionally, some treatment teams may not prioritize concerns effectively. On the surface, they may not present as the average person with depression, which can be confusing to friends, coworkers, loved ones, and even professionals. If you are struggling with functional depression, certain changes in lifestyle may be very beneficial and often helpful in supporting individuals to cope through depressed mood. These lifestyle changes may include diet, exercise, adequate sleep, not using substances, and involvement with a social support network. However, it is very important to acknowledge that people experiencing functional depression may find it very hard to begin new behaviors or setting new routines. This is why it can be very beneficial to engage in a therapeutic setting, so that way a professional can support you through any concerns and the difficulties in getting started. Here are 7 tips to lessen depression. As discussed, contacting a psychotherapist. Please schedule an initial meeting as soon as possible. The sooner the better. However, and always remember, it is never too late to receive the support you deserve. Adding exercise to your routine. Please ensure that any exercise you may engage in is cleared by your doctor or physician. Physical activity has been strongly linked to improvements in mental health overall, especially for mood across all ages. This is particularly true for people experiencing chronic depression or persistent depressive disorder, and for depression that is related to chronic feelings of anxiety. Setting goals, preferably ones that are achievable, can really support boosting your self-confidence and give you a sense of accomplishment. Begin to make improvements in your diet. Please feel free to consult a nutritionist, dietitian, or your doctor. However, certain changes in diet can lead to less feelings of sluggishness and also improve one's focus. Establishing a consistent sleep and waking routine. Healthy sleeping habits have been linked to improved mood and health overall. Limiting or omitting the use of alcohol or other substances. If you are struggling to limit or omit your use, please seek support from a professional that specializes in substance misuse. Reaching out to family, friends, community, and these community members could be local or even online. Loved one and community support are extremely beneficial in receiving the emotional support that you deserve. Typically, a person that functions at a high level when feeling depressed is a very self-driven person that also has high expectations of themselves. They may find it very difficult to ask for help or to admit that they're struggling. If you're feeling that you may be dealing with high-functioning depression, reaching out to a therapist or a trusted friend or loved one can be the first step in getting the support that you deserve. It can make a big difference in how you feel. Here are some ways to find a therapist for high-functioning depression. Asking your primary care physician for a referral to a psychotherapist. Asking your health insurance company for a list of in-network providers near you. Use of an online therapist directory. And contacting your local community health center or mental health center. We've linked resources in the description below to help you find a therapist, a psychiatrist, as well as other helpful resources.